Ellen asks, what techniques are you performing to your patients? Hands, instruments? Well, mostly, as I said before, I do something called the Gonstead technique, which is a manual technique. You use your hands. I find it's very good. It's very specific, so you can find the vertebra as opposed to doing a general kind of manipulation. If you find the vertebra that's really fixated or locked up and get that to move, then everything else will move more freely. If you work on the area of compensation, sometimes the patient will have a reaction where you're already working on where the body is overworking, overcompensating for an area that doesn't move. So as I showed before, this is the area you're looking for. You're looking for an area like this. You do something called motion palpation, where you check out each vertebra. You feel the muscles. You feel if the patient gives you some feedback if there's tenderness in that area. So you find the area that's locked up. You get this to move more like this, and the patient starts feeling better almost immediately. So that by hand, most of my adjustments, but I also have an instrument. Sounds like you're familiar with chiropractic. You know that we do some instrument adjusting. Now, this thing looks like a little ray gun here, but it just gives a little bit of pressure. It does vibrations. This vibrates 13 times a second, which supposedly stimulates the proprioceptors around the joint, so the brain starts to get information from an area that's locked up. Because the area that's locked up isn't really coordinating with the rest of the spine in terms of the signals going back and forth from the area that's fixated back to the brain. So that's how the brain just tends to adjust things on its own. Because one of my instructors once said something that stuck with me. He said that the chiropractor doesn't do the adjustment. The body adjusts after the chiropractor manipulates, which makes a lot of sense to me. So now what this does by vibrating, it will loosen that joint. So you're getting it, you're finding the spot the same way you would do if you were going to do a manual manipulation. You find the area and then you vibrate it so that this area will become more like this area. So whether you get it to move suddenly with a manual adjustment or you get it to move gradually with the vibrations, I find this takes a bit longer to get a person out of pain when you use this, but it works. And I'll use it on people who are fragile. In fact, I had an infant. People brought their infant over. I think the baby was about 10 or 11 months old. Now, I'm not going to do a manual manipulation, although I have done it in the past. I've taken chiropractic pediatric courses, and we use a finger and just gently move a joint. But you could also use this. In fact, this comes off, and it gives you a very small area. So now, it's very rare for me to adjust infants, but sometimes I will adjust the upper neck, have a patient lay on the side, and just give it a little bit of force in there and get the joint to move. Sometimes I'll adjust myself with this thing.